Hi everyone, I'm Steve, back here with Dr. Nario of Biointegrative Health Center. Biointegrative Health Center is in Reno, Nevada. You can find them online and find out all the treatments and IVs and all those things that they do right online, Biointegrative Health Center. So welcome, Doctor.
Hi, Steve. Thank you for having me again.
Okay, so we've been talking about different IV treatments, which, as you know, I'm a huge fan of. We talked about omega C, 50,000 milligrams of vitamin C. We're going through and talking about a lot of different IV treatments which you offer at the clinic, and actually most of which I've had at one time or another in the last 5-6 years. So today I want to talk about a treatment that I actually get every other week, a vitamin bag. And I know that you kind of specialize it for me, for kind of what you see on my blood work and so on. So what's a vitamin bag or a vitamin IV?
Well, you're right, Steve. You're one of our frequent flyers, so you definitely know what the IVs here in the clinic are. And the thing here is, vitamin IV. That is one of the basic IVs that every clinic should have or might have, and it comes in different sizes, shapes, and dosages. But the main point here is they're all vitamins and, of course, minerals, and made dependent on the purpose, meaning if you want to boost the immune system, if you want to actually fill up the nutritional deficiencies. It's also made in relation to the type of patient, meaning you can adjust the vitamin drip in relation to a liver that is damaged or a kidney that is damaged. And even you can adjust the dosing of the vitamin drip in relation to the deficiencies of a patient. If they have they have less B's, you need to add more of that. If they have less C's, you have to give more of those. But it all started to relate everything to Dr. John Myers, or not John Mayer, not the singer. He's a Maryland physician who used intravenous injections and nutrients to treat chronic conditions, which led to good health results. And to address what the specific concepts of why we use the IV vitamin drips, deficiency number one, increasing blood concentrations of essential vitamins and minerals versus oral supplementation, actually, as we discussed before, is not comparable. Thus, IV delivers more to the deficient cell. Number two would be gut malabsorption. If somebody has a gut damage, you would hear leaky gut, IBS, Crohn's. This impairs absorption of nutrients and vitamins if we take it orally. Thus, IV infusion bypasses this gate, and this digestion is not going to be affecting the absorption of our nutrients. And lastly, we jumpstart the cell through the vitamin drip. Temporary sudden increase in levels in the bloodstream of nutrients leads to forced pushing of nutrients into the cell. This will shock the cells, giving it more power and revving up the mitochondria, thus jump-starting or kickstarts the energy production.
Okay, so you mentioned Myers cocktail, it's called, which is a general vitamin bag. Now I know at your clinic that you can get much more specific to meet someone's individual needs, but I know you hear about these mobile IV trucks and so on, and I think they're just using a Myers, and I'm not saying a Myers is bad, because it's awesome.
Right.
All I'm saying is that at the clinic, it can be more specific, like the vitamin bag I get. So what are some of the differences? I know they're all good. It's just we're all individuals. So what are some of the different mixtures, ingredients, combinations that you can use? of vitamins, minerals, and so on.
Well, Steve, you're right. There are many variations in names to the IV, like Myers, that's the standard, but you can call it the immune booster, the anti-aging drip, the beauty glow, the hangover therapy. Many names, same concept. Vitamins and minerals with different dosing in relation to the purpose. You can even hear dog ate my homework or yeah, shake and bake. Anything, but the concept remains that vitamins and minerals are made for the patient who needs it. And just to give you the more common ingredients of these so-called IVs, the most common you would see would be vitamin C, vitamin B, B complex, magnesium, and even calcium. So you just mix and match, adjust the dosing as much as you want in relation to the needs of the patient. So let me run it down why we choose to include this specific ingredient, like for thiamine or B1. If a patient is, for example, alcoholic or the hangover drip has a lot of these, it depletes B1. And if somebody needs carbohydrate metabolism and boosting, B1 is your guy. And then B2 riboflavin if the patient needs more antioxidation, B3 for which is niacin, more for cholesterol control and cardiovascular protection. D5 dexpanthenol breaks down on carbohydrates and fats, easy for us to better absorb it. And pyridoxine, which is B6, more for nerves and neuropathy. And for the magnesium, which is sulfate most of the time, or even chloride that you can use, used for asthma, muscle cramps, migraine. And if you think about it in the real world, our food is mostly magnesium deficient because of all the processing that it goes through and should be part of any vitamin drip. So that's a tip for every clinic out there that's doing this. And blood pressure controller, magnesium is good for that because it prevents the calcium to go into cells to control the spikes of our blood pressure readings. And lastly, calcium, you use this really more for nerve conduction, when you have tingling hands, tingling feet, and muscle contraction, especially the heart, if we need to enhance that, and also regulates cardiovascular functions such as blood pressure and heart rate monitoring or functioning.
Yeah, you know, I could just go forever on this stuff, but I know there's a lot of stuff in a vitamin bag. We talked about omega C, which is 50,000 milligrams of vitamin C, usually in omega C. But in the vitamin bag that we're talking about today has a lot of the B vitamins. Again, it's right there, you know, right into your vein. But this vitamin bag has a ton of vitamin C in it also, doesn't it? So how much vitamin C is in this?
All right, Steve, so that's a very good comparison. But before I move forward, let me remind the viewers what omega C is. This is a very short description of it. Omega C packs a wallop in the vitamin C department to beat a sack of oranges. Again, you don't have to peel that much oranges to drink it and get gallons of OJ in your system. The thing here is omega C means high dose in the real world. You would usually hear it being 50 grams or higher. That's omega C. But anything lower than that is actually being used in a vitamin drip. So when we choose to use that specific dose, we're focusing on general immune system boosting, antioxidant support, and also when you actually go for those type of functions, it's safer. And omega C has so many preparations that's involved with it. Lab tests, you have to make sure that you assess the patient in terms of the function of the liver and the kidney. But using a lower dose, I'm not saying it's safe, but definitely safer. So when you choose to use that type of dose in patients, you're focusing more of antioxidation to neutralize the free radicals that destroys organs responsible for faster aging. It's also the vitamin C is also for the cofactor for collagen and to build more tissues and fight infections. And even as defined as these lower doses, when compared to oral doses, again, even though I mentioned that dose, that our limit for our gut is only 2,000 milligrams. And as I mentioned, 50 grams, anything lower than 50 grams is something used in a vitamin drip. You still can't use and convert that as an oral dose to put in your mouth. So it still has to go through IV to avoid gastric irritation, diarrhea, cramps, and also to give you the maximum effect.
So how many milligrams of vitamin C are, say, in the vitamin bag that I receive every other week?
So for somebody somebody receiving just regular vitamin drips would be around 25 to 30 grams. Just more for the health maintenance and no cancer history, no autoimmune conditions. So that's the safer one for, especially for an athlete like you.
And that's a lot of vitamin C still. So
Yes.
let's talk about one of my favorite things that are in these vitamin bags that you put in my bag, amino acids. So I know there's tons of amino acids, different amino acids in the bag. So, so talk a little bit about the multiple amino acids that are in the bag, you know, all the essential amino acids, but also talk a little bit about why are all those amino acids going into my vein? What's the benefit for my body?
Well, see, the amino acids are actually something that can be optional for any practice out there, but we choose to put it in there, especially for guys like you, the athletes who needs protein to build their muscles. So it's really dependent again. I don't expect practices out there to be doing this, but we have our special, I guess, tweaks on the IVs that we give. But for the amino acids that we give here, we actually, excuse me, we give our patients at least 17 amino acids in that IV. So again, amino acids, they're building blocks of proteins. And again, aging and stress actually lowers down the production of our amino acids. And one reason a body starts to become weaker as we get older is because we gain fat instead of muscle, and skin starts to sag. Variety of roles in the body, really. And not only to build muscle are we using amino acids or to fight wrinkles, but it also is to modulate neurotransmitters, which acts like hormones. And the thing here, we perceive this in everybody. Everybody's aging. That's why I mentioned that we need to give amino acids to our patients. That's why we chose to put it in there. But to name the more popular ones in our concoction here is we have 3 important components, or maybe 2 important components of glutathione, which is glycine and glutamic acid. That's part of the component that we give. And we're not including cysteine in there for the reason that we get a lot of cysteine in our food already. So combining all of these with a healthy diet produces that glutathione naturally. And of course, BCAAs. So we always know about this. BCAAs, we only can take that from external sources or our diet to build muscle, to build our recovery, to make our recovery faster, especially for athletes like you. Lysine is in there also, which improves calcium absorption and tissue growth and recovery. And we also need this to provide and create antibodies, enzymes, and hormones. Tryptophan, a precursor for our neurotransmitters, such especially serotonin, to prevent depression, insomnia, and anxiety. And also we have tyrosine in there for healthy brain function to regulate the neurotransmitters, especially regulate adrenaline and dopamine. Also helps reduce stress and improve mental alertness. And another good one is arginine. We all know it's a precursor for the production of nitric oxide. And as we all know, nitric oxide is important for healthy circulatory maintenance and functioning.
Okay, so I want to go into the use of vitamin bags, but can you just touch on real quickly? I know there's one thing that's not in a vitamin bag, and correct me if I'm wrong, but it's vitamin D. Could you just touch on that real quickly? I'm correct, I believe, that vitamin D is not in it. Could you just tell us why?
Yes. The reason for vitamin D not being in a bag is basically it's fat soluble, meaning the majority of the the vitamins that we give in the IV bag are water soluble, meaning it can actually go into your system without any problems, not causing pain or discomfort. Vitamin D it actually is more suitable as an injection for the reason that fat is to fat, meaning you're putting an oil-based solution into your muscle. So a muscle can act as a depot, and also it also is covered by fat at the same time, and it's actually distributed into your system slowly. The reason why you're not going to put that in an IV bag is because when you put fat in your IV, then you now come across to the problem of fat embolism. So you don't. That's not a good thing to have if you're looking out for complications during IV therapy.
Okay, thanks. I was just that's kind of a interesting thing. I just kind of wanted to throw that in there. So, okay, last question. What do you specifically have certain patients that you actually use this vitamin bag for, or what kind of patients? Or I consider myself extremely healthy, especially for my age. Who could What specifically do you use vitamin bags for? Can you just give me an example or two? And then who could benefit? I mean, that sounds kind of like a stupid question because everyone could benefit from a vitamin bag, but just give us some generalities on who could benefit from a vitamin bag in addition to that.
All right. Well, no stupid questions here, Steve. Everything is legit. The thing here is vitamin bags are, you're right, for everybody. Somebody who's just looking for health maintenance, somebody who just has a tickle in their throat, an athlete who just wants to boost their performance. But again, I have to make sure that professional athletes or in competition cannot do these things because this can violate some of their rules. And that's why I tell my athletes check their handbook or rule book before they get IV therapies. But as far as I know, professional athletes cannot do this. But in general, we give it to patients who has conditions such as acute asthma, migraines, chronic fatigue, fibromyalgia, muscle spasms, upper respiratory tract infections, sinusitis, seasonal allergies, cardiovascular disease, almost anybody really. But the thing here is you have to make sure that you go to a provider who knows how to tailor made your needs. And that's the thing. There's so many ways in how we can get vitamins into our system through food and also supplementation. But the thing here is the food source that we have right now is lacking in this type of nutrition. And also, when we take supplements in, we have leaky gut. We have bad guts that does not absorb these supplements properly. That's why customization is the key when you get these vitamin bags. You take the medical history, you get the laboratories, you ask the patients their health goals. And again, there's nothing that will beat years of experience and also trained medical professionals that will administer this IV to you. And we have to understand also interactions, dosing, and especially safety. But again, these things are very safe to take. I take it myself. You have taken them. And it's just a happier version of everybody, especially me. It's like I feel better when I get it.
Yeah, okay. Doc, that when you say athletes aren't allowed, professional athletes are not allowed to do this, that's going to make people want to come get this IV, right? It's like,
well, at least
professional athletes
I told them.
Oh, no. Okay, I want one. Anyway, thank you, Doctor. That's Dr. Nario, Biointegrative Health Center in Reno, Nevada. Always appreciate your wisdom and what you bring to these interviews. So Dr. Nario, Biointegrative Health Center, Reno, Nevada. Look him up online. Thanks for being with us.
Thanks, Steve, for having me. And again, thank you for inviting us always. And again, the knowledge that I feed everybody is something that I hope everybody gets something out of. And knowledge is power. And again, I impart the biological edge in terms of what I teach to my patients and to the viewers.